So we talked about this a little bit already. Okay. Here's other things you got to be watched for when they're out and about. Walking on somebody's property, abandoned wells, abandoned shafts, abandoned mines. They can easily slip and fall. The scary part for me about that is lots of times they're working alone. I don't know exactly how the schedules will work. Is somebody checking in on them, or they happen to check in and check out for the day and then check back in at the end of the day? How would we know if they did fall down a hole somewhere, where they're at? Where do we even start? So those are things to think about too, and to discuss as safety issues. I mean, do they have a list of potential areas they're going to that day, and where they're going to be in approximate times, and are they checking in and out? Grading, missing grading, you see that? I mean, you can see this anywhere, really. Restaurants that they might go into, other schools, facilities that you might go do training at, your training staff. So these are the types of things to look for. This is an easy break your ankle, twist your ankle type thing. You step on that grading or miss that grading, and down you go into that hole. Okay. So material handling, or what we like to call strains and sprains. It's always difficult. We lift things, we take it for granted. As we mature in our work experience, our bodies don't recover as fast as they did years ago in our 20s. So something that we may have been able to walk off or shake off earlier in life, it might take us 2, 3, a week, 10 days, a little bit longer to recover from. So we need to think about the weight of something we're going to lift. And the rule of thumb is, if there's an object and you can lift it with the 4 fingers on your hand, you can test it by the corner. If you can lift the object using your 4 fingers underneath it and lift it up, it's probably okay for you to lift and manage. If you can't lift it, or you have to really strain or push to pick it up, it's probably too heavy for you to lift and carry by yourself. Think about the size, okay? Might be too heavy. It might be an awkward position. It might be long. You might need to get help. You might need a cart. You might need a dolly. You might need some type of assistive device to help you. The path that you're going to go. Most of us pick up the item and go where we're going to go. We don't think about, do I have to open a door? How am I going to keep the door open? So we kind of shimmy our way through the door with the box resting on our knee, trying to open the door with the other hand, and then shimmying through the door and causing all kinds of strains and sprains, pinched fingers, and all that kind of stuff. Also, when you go to lift something, if you have to jerk it or hold your breath while you're lifting it, it's probably too heavy for us to handle. Okay, so we probably need to get help. So those are some of those things that you need to make sure of. Do you know where you're going? Is the pathway clear? Do you need assistance getting it somewhere? And is it too heavy for you to operate? So how do you actually make a lift? Well, what you want to do is you want to get as close to that object as you possibly can. Ideally, it would like to be at waist level because that's your center of gravity. You want to use handles if you have them. You want one foot slightly in front of the other, about shoulder width apart, and then you want to gradually lift whatever object it is. You don't want to jerk it up, because if you jerk it up, then that's strains and sprains issues. Then once you have the box in your hand, you want to turn your whole body, not twist. You want to put me on so we can,
Sure.
I can sort of demonstrate it. We're going to pretend that the podium is what I'm going to lift. So you want to get as close to it as you can. You want your feet about shoulders width apart, 1 foot slightly in front of the other. You want to use the palms of your hands, not necessarily your fingertips, because if you use your fingertips, there's the potential for it to slide. So you want to pick it up. You might need to bend your legs slightly depending on what the object is, and then gradually lift it. You don't want to jerk it up. And then once you've got it, we're pretending I'm lifting something, you want to turn your whole body. You don't want to twist, because it's that lift and twist that gets you.
Torque.
Yep, that's what gets us. 9 times out of 10, most of us at some point in our lives are going to have a lower back injury, whether we've done it at home, playing sports, at work, and once you have that lower back injury, or you threw your back out, you're never the same again. And if you have to have back surgery, that's even worse. So, okay. Okay. All right. Now, I don't know if there's any people from the Office of the Medical Examiner here, but this is one of their lifting exposures. They actually, at some point, often have to transport decedents from the hospital to the coroner's office or to their autopsy facility. So they have to use this type of stretcher. Sometimes they're by themselves. This is an ideal situation where there's 2 of them, and we mock this up because we've actually done some work with them for this particular lifting exposure. So depending on the size of the individual that might be on that gurney, you might have a thin person, you might have a 600-pound person. They have to pull this the stretcher or gurney up and get it up into the back of this van, take them where they got to go, back to the medical examiner's office, unload the individual, and then do what they have to do on their end of it. So this is a big exposure for them. Okay? There may be lifting things, equipment, and stuff that staff have to lift in and out. I know some of the WIC people that do WIC, lots of times they have they have a car seat program, I think. They do breastfeeding education. They do a lot of stuff. They have lots of samples and stuff that they take, or I've seen them when I've been out. They have lots of different things that they do, and a lot of the education, they've got the big displays, backboards, and all that kind of stuff that they're taking, or prop displays to do their education. So all that stuff's heavy, and somebody's got to transport it in and out. So that's a lifting exposure. Here's just a regular office lifting exposure, bending over to get paper to put in a copy machine. A ream of papers can be pretty heavy, and then if you're messing with a whole box, that's about 50 pounds. Okay? So here's a lifting exposure. Mail, having to lift mail and put it places, bending over, just your day-to-day operations, and that's not including maybe if it's a nursing staff and there's a patient or a client that needs to be moved from a wheelchair up to the examination table. Somebody's got to help do that or get them down off of it, or maybe an elderly individual that's not very steady and can pull them down, trying to prevent falls. I know, I'm going to say my age, but when I was going through training, it used to be you always put yourself between the patient and the floor and let the patient slide down your body, and you're the one that got injured. That's hard habits to break. It's really hard habits to break. So, that's an exposure too, because you're lifting lots of times, 100 plus pounds of somebody that you're trying to get up. Okay? Hand safety. We don't think about this a lot. Okay? Paper cuts, staples to the finger, fingers pinched in drawers, fingers pinched in doors, all kinds of stuff. So think about those things. Think about sharp objects that might be somewhere, light switches, those types of things. We can be struck by, it can be caught in between, or a cut, puncture, and scrape. Think about it when you're carrying your items with that material handling. You're lifting through a doorway, you crunch your fingers around the door frame, closing drawers. How about cleaning up broken glass? That never happens, does it? Are we using a broom and a mop, or are we picking up the pieces with our fingers? Okay? Broom and a mop, especially if it's in a clinical setting, because we don't know what that was in that, or what we might be exposed to. And then once we've got this broken glass, how are we disposing of it? Because somebody, if we just put it in the regular trash, somebody has to empty that trash, and there's another cut potential. So do we have cardboard boxes that are for broken glass? Are we lining, putting it in a box and marking it or something like that? So that's all those types of things from a safety perspective that we kind of have to look at.